Hi everyone, my name is Delilah, and in this video I will be demonstrating the proper use of the universal curette and Gracie curettes. I will go over the instrument parts, grasp, working order, angulation, adaptation, stroke activation, indications, and contradictions for both instruments. Let's start by discussing the universal curette and how to hold it properly. It has a rounded toe, which makes it safe for subgingival scaling and root planning. There are two cutting edges per working end, meaning both edges can be used for scaling. The face of the blade is at a 90-degree angle to the terminal shank, so we need to tilt it slightly to achieve the correct working angulation. To hold the instrument correctly, we use the modified pen grasp. The thumb and index finger hold the instrument handle in a C shape using the fat pads. The middle finger rests slightly on the shank for sensitivity to detect calculus. The ring finger acts as a fulcrum placed on a stable surface to provide support and control. The little finger stays relaxed and tucked away. When to use the universal curette? It's used for both anterior and posterior teeth. It's effective for removing moderate to heavy calculus from the crown to root surfaces and can be used for both supragingival and subgingival scaling. When not to use the universal curette? Since the blade is at a 90 degrees, we must tilt the instrument slightly for correct angulation. If we don't, it won't remove deposits properly. Not as effective for deep pockets because of its wider blade, and if it's used with improper angulation, it can cause tissue trauma and discomfort to the patient. The universal curette can be used on all surfaces of all teeth, making it very versatile. Working order on a tooth. You start at the distal line angle, working distally into the interproximal spaces. Turn to the distal line angle, then instrument mesially into the interproximal space. The angulation is closed, insert, open. Before inserting, the blade should be closed to 0 to 40 degrees to avoid tissue trauma. Insert the working end into the sulcus, keeping it closed against the tooth. Once inserted, open the blade to 60 to 80 degrees for effective calculus removal. You want to use short, controlled strokes to effectively remove deposits. Apply vertical or oblique strokes with moderate to firm pressure, and ensure strokes are limited to areas with calculus to avoid unnecessary irritation. And this is how we would use the universal curette on an anterior tooth. Right now, I'm going to do away surfaces. Close, insert, open. Toward surfaces. Now I will be demonstrating the proper use of the Gracie curettes. We have the Gracie 1-2, the 11-12, 13-14, and I will go over the instrument parts, grasp, working order, angulation, adaptation, stroke activation, indications, and contradictions for these instruments. The Gracie has a rounded toe, just like the universal curette, making it safe for subgingival scaling. However, only one cutting edge per working end is used. This is the lower edge. The blade is at a 70-degree angle to the terminal shank, meaning it is already correctly angled and does not need extra tilting. Like the universal curette, we also use the modified pen grasp for the Gracie curette. Thumb and index fingers hold the handle in a C shape using the pads of our fingers. Middle finger rests on the shank for sensitivity, and the ring finger acts as a stable fulcrum. When to use the Gracie curette? It's designed for subgingival scaling and root planning. Each curette is area specific, meaning it adapts better to specific surfaces, and it's more effective for deep periodontal pockets than the universal curette. To use on anterior teeth, we split the tooth in half and do the toward surfaces and then away surfaces. You want to use controlled, overlapping strokes to remove deposits effectively. Apply vertical, oblique, or horizontal strokes depending on the area. Use firm pressure for scaling strokes and light pressure for exploratory strokes. This is the Gracie 13-14. The Gracie 13-14 is for distal surfaces of posterior teeth. We use the lowest cutting edge and we start at the distal line angle, moving distally into the interproximal. C1112 is for mesial surfaces of posterior teeth. We also used the lowest working end, and we start at the distal line angle, then pivot and move mesially. The angulation is always close, insert, open. Before insertion, the blade should always be closed 0 to 40 degrees to avoid tissue trauma. Once inserted, open to 60 to 80 degrees for effective calculus removal. When not to use the Gracie curette, it's not ideal for heavy supragingival deposits because of its finer blade design. We must use the correct Gracie for the correct surface. Using the wrong one will not work properly. And it's not as efficient for quick, all-surface scaling compared to the universal curette. The universal curette is a versatile instrument that can be used on all teeth and surfaces, while Gracie curettes are area-specific and provide better adaptation to individual tooth surfaces. Knowing when and where to use each instrument helps ensure comfort, efficiency, and proper calculus removal. Thank you for watching.